Hello everybody, today we're gonna go over administration of insulin subcutaneous via a pen method. We'll start by checking our orders, and as you can see, in this example, the physician has ordered Lantus 10 units subcutaneously, and we just entered the time right now for the purposes of demonstration. As you can see right here, I have the medication. We're gonna go over our 10 rounds of medication administration, and also insulin. In a lot of institutions, it is considered a high-risk medication, so 2 licensed professionals must be available to double-check the dose prior to administration. Now we're gonna select a landmark site for our subcutaneous injection. The most common subcutaneous sites include the back of the arms. Make sure that we avoid any lines, such as the PICC lines. Also, umbilicus is probably one of the most accessible sites for the patients. You find the umbilicus 3 to 2 fingers away from the umbilical, and you find the site there. Make sure it's free of bruises, any skin tears, or any openings. Alternatively, the thighs of the patients are always another option for a injection site. Alright, now that we have selected our landmark site, let's prepare our insulin. Always, let's start with our hand hygiene, right? Very important. Once we've done our hand hygiene and we have done our 10 rights, we're gonna grab our medication, our Insulin-Pen, remove the cap, and roll the pen around. Especially if it's a mixed insulin, right? You wanna make sure that is rolled properly. Once that has been done, you're gonna grab your auto shield, the actual needle that goes in, peel it up. Be cautious. Underneath here is where the needle is. You're going to push it in, twist it on. Okay, now at this point we have to dial 2 units of the Lantus to prime the needle, because at this moment there's air inside. So what you're going to do is we're going to dial up to 2, as you can see there. Yes, and you're going to push down here on the button, and you should see medication coming out like that. If you do not see that, prime it again with another 2 units and try it again. Okay, now that the insulin pen has been primed, it's ready to administer to the patient. But before we do that, I'm going to cap it back up, and we're going to dial the actual dose of the patient, which in this example was 10 units of the Lantus. So as you can see, after I prime the needle, it goes back up to 0, right? So we're going to dial it to 10, which is our order, and right here, right? And right now is the time that you will have another nurse or another licensed professional to do an independent double check, as insulin in a lot of institutions is considered high-risk medication. All right, now after we have checked that this is the correct patient, doing our positive patient identifiers, make sure we ask the patient's name and check the ID band. We're gonna turn on gloves. Okay, we identify the site for the patient. We're gonna do the umbilical part. We're going to clean it with alcohol. And as it dries, we have our Lantus that we pre-checked already. Just a final double check that it is still at the 10 units, right? Once it's out, all we need to do is just 90 degrees down until you hear the click, and then you're gonna use your thumb up here and push down. Once you push all the way down, you're gonna count to 5 seconds. 1, 2, 3, 4, 5, and then we're just gonna release. And as you can see, this is how the needle is supposed to turn out. This is the safety guard. At this point, we're going to disconnect this, right? And the needle has already been capped. The insulin, we're going to put it back with the actual this, and the needle will go into our sharps container right here. Once that's done, we're going to cover back our patient, and we're just going to sign off our insulin that was given. Team, that's how we administer our insulin pen. Bye for now.